Hello everyone, my name is Mabel Mary Lincoy, Assistant Professor, School of Pharmaceutical Sciences, USTM. So in this presentation, I will be discussing with you the topic disorder of the endocrine system. So endocrine system is a system which consists of or which includes the various different glands which are present in our body, and these glands they secrete or produce different hormones. So these hormones they are needed for the growth and development of our body and also to regulate the functions of our body organs. First we will see the disorder of the pituitary glands. So pituitary gland is divided into two parts, that is anterior pituitary gland and posterior pituitary gland. So first we will see the disorder of the anterior pituitary glands, which includes acromegaly, gigantism, dwarfism, hyperprolactinemia and Siemens disease. So first we will see what is acromegaly. So acromegaly, it is a condition where hypersecretion of growth hormones during adulthood they cause acromegaly. So the bones becomes abnormally thick and also thickening of the soft tissue. These changes are notified in the facial features like excess growth of lower jaw, enlarged tongue and excess large hands and feet. Then next is gigantism. Gigantism, it is a condition of hypersecretion of growth hormones during childhood cause gigantism. So the hypersecretion of growth hormones during adulthood they cause acromegaly, whereas in case of childhood they cause gigantism. It is the abnormal increase in the length of bones. The affected individuals may grow to a height of 2.1 to 2.4 meter, yet body proportions remains normal. So dwarfism, it is caused by severe deficiency of growth hormones during childhood. The affected individuals is small but well proportioned body. Cognitive development is also not affected. So a person with the condition of dwarfism has a very an abnormal short in height, which is happened due to deficiency or lack of the growth hormones secreted during childhood. Next is the Siemens disease. So Siemens disease is commonly due to a tumor in the anterior lobe of the pituitary gland. It generally affects the blood supply and also the functions. Then hyperprolactinemia. It is caused by a tumor that secretes large amount of prolactin. And prolactin, it is a hormone which regulates the milk production in case of breastfeeding mothers. So the hyperprolactinemia or increase in the secretion of prolactin hormone causes galactonuria. It is nothing but inappropriate milk secretions. Okay, next one is the disorder of the posterior pituitary. So disorder of the posterior pituitary includes the diabetes insipidus, which is a most commonly type of the disorder of posterior pituitary gland. So diabetes insipidus, it is very rare condition. Usually it caused by hyposecretion of ADH, that is antidiuretic hormone, due to damage of the hypothalamus. Damages generally occur due to the brain tumor, trauma and encephalitis. It also occurs when water reabsorption by the renal tubules is impaired. It causes excretion of excess amount of dilute urine, causing dehydration and extreme thirst, also termed as the polydipsia. So disorder of the thyroid hormones. The disorder of thyroid hormone falls in two main categories, that is hyperthyroidism, which is due to the increase in the secretion of thyroid hormones, or hypothyroidism, which is due to the decrease in the secretion of thyroid hormones. So example for hyperthyroidism is Graves' disease and hypothyroidism is cretinism, myxedema and goiter. Then we will see what is hyperthyroidism. So hyperthyroidism, it is the increase in the level of T3 and T4 hormones. It includes Graves' disease. So this Graves' disease, it is mainly affected in women more than that of men, and the most common between the age of 30 to 50 years. It is an autoimmune disorder in which an antibody mimics the effect of thyroid stimulating hormones. It causes increased release of T3 and T4 and produce signs of hyperthyroidism. It includes goiter and exophthalmos. Yes? Oh my god. Okay, just hello everyone, my name is Mabel Mary Lincoy, Assistant Professor, School of Pharmaceutical Sciences, USTM. So, in this presentation, I will be explaining you the topic that is disorder of the endocrine system. So, endocrine system, as we all know, it is a system which consists of various glands or different glands. These glands, they produce or secretes various hormones respectively. And these hormones, they are needed or are essential for the growth and development of our body and also for the various functions of our body organs. First, we will see the disorder of the pituitary glands. So, pituitary glands is divided into two parts, that is anterior pituitary gland and posterior pituitary gland. So, first we will see what are the disorder of the anterior pituitary glands. It includes acromegaly, gigantism, dwarfism, hyperprolactinemia and Siemens disease. First, we will see what is acromegaly. So, acromegaly, it is a conditions where hypersecretion of growth hormones during adulthood, they cause acromegaly. So, the bones becomes abnormally thick and also thickening of the soft tissue. These changes are notified in the facial features like excess growth of lower jaw, enlarged tongue and excess large hands and feet. Next, we will see what is gigantism. Gigantism is a condition which is caused due to hypersecretion of growth hormones during childhood. So, during childhood, increase or excess secretion of growth hormone leads to gigantism. It is abnormal increase in the length of bones. The affected individuals may grow to a height of 2.1 to 2.4 meter, yet body proportions remain normal. Next is dwarfism. So, dwarfism, it is a condition which is caused by severe deficiency of growth hormones during childhood or by the lack of growth hormones during childhood or hyposecretion of growth hormones during childhood. So, the affected individuals is small but well proportioned body. Cognitive development is also not affected. The next is Siemens disease. It is commonly due to tumor in the anterior lobe of the pituitary gland. Generally, the blood supply and also the function is affected in case of Siemens disease. Next one is hyperprolactinemia. So, hyperprolactinemia is again, it is a conditions which is caused by a tumor that secrete large amount of prolactin. And prolactin, it is a hormone which regulates the milk secretion. Then it causes galactonuria, that is inappropriate milk secretion. Next one, disorder of the posterior pituitary gland. So diabetes insipidus is one of the main disorder of the posterior pituitary glands. So diabetes insipidus, it is a rare condition usually caused by hyposecretion of ADH due to damage to the hypothalamus. So damage is generally occurs due to a brain tumor, trauma and encephalitis. It also occurs when water reabsorption by the renal tubule is impaired. It causes excretion in excess amount of dilute urine, causing dehydration and extreme thirst, also termed as polydipsia. So in diabetes insipidus, the pituitary glands produce insufficient ADH, that means the antidiuretic hormones is less, and because of that the kidney makes a lot of urine, and also the urine get expelled or it gets removed very much at a very excess amount, which causes the person to feel extreme thirst and also dehydration. Next is the disorder of the thyroid gland. So disorders of thyroid gland falls into two main categories, that is hyperthyroidism and hypothyroidism. Hyperthyroidism, which is due to increase in the level of the thyroid hormones, and hypothyroidism, which is due to the decrease in the level of thyroid hormones. So hyperthyroidism, example Graves' disease, and hypothyroidism, example is cretinism, myxedema and goiter. So hyperthyroidism, the increase in the level of T3 and T4 hormones that causes Graves' disease. Graves' disease, it is a condition which affects women more than men, and it is most common between the age of 50 and 30 years. It is an autoimmune disorder in which an antibody mimics the effect of the thyroid stimulating hormones. It causes increase in the release of T3 and T4 thyroid hormones and they produce signs of hyperthyroidism, leading to goiter and exophthalmos. So goiter is nothing but it is the enlargement of the thyroid glands, and at exophthalmos it is a condition where the protrusion of the eyeballs can be seen due to deposition of excess fats and fibrous tissue beyond the eye. So we'll see what is hypothyroidism. So hypothyroidism, it is the decrease in the T3 and the T4 secretion. We'll see what is cretinism. Example cretinism, it is caused by deficiency of thyroid hormones in infants. It produces a slow body growth and mental development. Other symptoms also include slow heart rate, lower BP, decrease in the body temperature, protruding tongue, and also retarded in the sexual development. Next one, we'll see what is myxedema. Myxedema is a condition which is caused by deficiency of thyroid hormones in adults. It is 5 times more prevalent in women than men. The patient lack alertness, intelligence, and initiative. Also suffer from a slow heart rate or a slow heartbeat, low body temperature, and retarded in also sexual development. Next is a simple goiter. So simple goiter or goiter, it is an enlargement of the thyroid gland. It is caused by relative lack of T3 and T4 hormones or low level of the thyroid stimulating hormone. Other causes are persistent iodine deficiency, genetic abnormality affecting the synthesis of T3 and T4 hormones. So next we'll see the disorder of the parathyroid gland. So parathyroid glands, again the disorder can be categorized in 2 types, that is hyperparathyroidism and hypoparathyroidism. First we will see what is hyperparathyroidism. So hyperparathyroidism, it is an excess secretion of the parathormones due to tumor of one of the parathyroid gland. It causes excess reabsorption of calcium ions from the bone matrix, raising the blood level of calcium and iron and phosphate ions, then formation of renal calculi or stones due to high blood calcium levels. So these renal calculi or renal stone, they are nothing but they are the deposited of the calcium ions. Then general fatigue and muscle weakness. That means generally the person will feel tired and they'll be experiencing muscle weakness. Then hypoparathyroidism is due to deficiency of parathyroid hormone or parathormones. It causes deficiency of blood calcium ions, also termed as hypocalcemia. Hypocalcemia is a condition where the blood calcium ions level is less, or deficiency of the blood calcium ions. Then there is a reduced reabsorption of calcium from small intestine and less reabsorption from the bones and glomerular filtrate. The low blood calcium level, they causes tenderness of skeletal muscles. It's nothing but it is the involuntary contraction of the skeletal muscles, anxiety, paresthesia, which is the rigidness in the leg and the hands, grand mal seizure. Grand mal seizure is nothing but it's a type of epilepsy, and development of cataract and brittle nails. Cataract, which is a condition which leads to blindness or loss of sight. The next is the disorder of adrenal cortex. So, what are the disorder of adrenal cortex? Example, Cushing syndromes, which cause due to hypersecretion of glucocorticoids, hyperaldosteronism, hypersecretion of mineralocorticoids, Addison disease, which cause due to hyposecretion of glucocorticoids and mineralocorticoids, and adrenal crisis and congenital adrenal hyperplasia. So these are some of the few examples of disorder of adrenal cortex. It is caused by excess secretion of cortisol, which may be due to any one of the following reasons. Abnormal secretion of ACTH due to tumor in pituitary gland, or hypersecretion of ACTH by the anterior pituitary gland, or prolonged therapeutic uses of systemic ACTH or glucocorticoids. So we will see what is Cushing syndromes. So Cushing syndrome, it is a condition or it is a disorder which occurs when your body makes too much of the hormones cortisol over a long period of time. So the signs and symptoms include fat deposition in upper abdomen, in the face, with thin hands. That means you can see when too much of fat is deposited in the face becomes round, almost resemble to that of the moon face. Then excessive tissue protein breakdown. Then osteoporosis, which is a disorders of the bones which causes weakness in the bones. Then atrophy of the lymphoid tissues, hypertension and hypoglycemia, which is the increase in the glucose level in our body. Then hyperaldosteronism, it is the excess secretion of aldosterone. It is of two types, primary and secondary. Primary aldosteronism, it is due to the excess secretion of mineralocorticoids caused by a tumor and affecting only one adrenal gland. In case of secondary aldosteronism, it is caused by excess high blood level of renin and angiotensin, and also due to cirrhosis of the liver. Then the symptoms include hypertension due to increase in the blood volume, severe depletion of potassium ions which cause renal damage, kidney failure and muscle weakness. Next, Addison disease. It is also known as chronic adrenocortical insufficiency. It is due to destruction of adrenal cortex that result in hyposecretion of glucocorticoids and mineralocorticoids. It is an autoimmune disorder in which adrenal cortex destroyed or block the binding of ACTH to its receptor. Autoimmune disorder means which occurs within the body and the cause is not known. Then symptoms of Addison's disease: pigmentation of the skin and the mucous membrane, means change in the color of the skin. You can see the skin color will change, and also in that of the mucous membrane. Then muscle weakness and wasting, GIT disturbances which include vomiting, diarrhea and anorexia, hypoglycemia and hypotension. That is, hypoglycemia is a condition which is there is a low level of glucose in the blood. Mental disturbances and confusion, electrolyte imbalance, and chronic dehydration. So these all are the symptoms of Addison's disease. So next is the disorder of the pancreatic islets, that means disorders of the pancreatic glands. Diabetes mellitus, it is caused by complete absence or relative deficiency of insulin hormones. So insulin hormones, it is a hormones which is produced by the pancreas, mainly by the beta cells. So when there is absence or when there is decrease in the level of insulin hormones, it leads to diabetes mellitus. So diabetes mellitus, it is of two types. Type 1, which is insulin dependent diabetes mellitus, and type 2, which is non-insulin dependent diabetes mellitus. So first we will see the type 1, that is the independent, which is the insulin dependent diabetes mellitus. So it occurs due to deficiency of insulin, which is caused by absence or disorders of the beta cells. So in case when the beta cells are absent or there is some disorder in the beta cells which leads to the hyposecretion or which leads to the decrease in the secretion of insulin hormones, it leads to the type 1 diabetes mellitus. It may be associated with acidosis or ketosis. It can occur at any age of life, but usually it occurs before 40 years of age. It can occur if it occurs in infant due to a congenital disorder, or in childhood, then it is known as juvenile diabetes. Then we'll see what is the type 2 diabetes mellitus. It is the most common form of disease which occurs after 40 years of age. So it is also called as maturity onset of diabetes. In this type, the structure functions of beta cells and insulin's blood level is normal. The cause are obesity, sedentary lifestyle, and genetic factors. So the type 2 is independent to that of the insulin. That means the insulin level, the beta cells were all normal. The concentration of insulin is also normal, whereas other factors such as obesity, sedentary lifestyle, and the genetic factors are the cause for the type 2 diabetes mellitus. So till here is the end of this presentation. I hope you all have understood the topic. Thank you.